I love this question because it carries a common issue that can happen when you're taking questions. See if you can guess it. Which of the following nursing diagnoses would be appropriate for a client with heart failure? Select all that apply. So what are we looking at here? We're looking at the relationship between nursing diagnosis and appropriate for heart failure. So we're looking for true statements, right? So let's look here. So you have to know something about heart failure, right? So let's look, and as you may remember that I encourage you to have something to write with as well as something to write on as you're doing questions with whomever you are doing questions with, and write down your answer as well as write down your rationale to see if you are building your critical thinking skills and thinking more like a nurse. Would it be nursing diagnosis of ineffective tissue perfusion related to decreased peripheral blood flow, secondary to decreased cardiac output, or activity intolerance related to increased cardiac output, C, decreased cardiac output related to structural and functional changes, and D, impaired gas exchange related to decreased sympathetic nervous system activity. I believe this is a nurses labs question. As you know, they have free questions. I do not receive anything from them, in no way tied with them. I just like their questions because they also give you the rationale of the correct and incorrect answers, and they have very good questions that I see, that I've observed. All right, go ahead and write your answer and then come back. Feel free to write it and reply. Here we go. So let's look at A, ineffective tissue perfusion related to decreased peripheral blood flow secondary to decreased cardiac output. As you know that when heart failure, what do you have here? You have an ineffective pump or a weakened heart. It doesn't have to be drawn out, right? So we know the heart is the pump for the body to push blood throughout and nutrients throughout the body. So we have to look at the first part of the question and the statement and the second part of the statement and make sure they are true. So yes, in heart failure, there is decreased cardiac output and ineffective, therefore there's going to be ineffective tissue perfusion because the heart is not putting out as much. B, activity intolerance related to increased cardiac output. All right, so let's look here. Activity intolerance, that is true. They're typically tired, but is it related to increased cardiac output or decreased? It's decreased, so that would be a false statement. C, decreased cardiac output related to structural and functional changes. Well, yes, we already said they have decreased cardiac output because of the pump not being effective. Is it related to structural and functional changes? Over time, yes. The heart, like any muscle, as you work it out, as it is trying its best to pump blood throughout the body, it stretches out and it changes. Therefore, its function changes. So C is correct. And D, impaired gas exchange related to decreased sympathetic nervous system activity. Yes, they're going to have impaired gas exchange because we know the lungs and heart work together. The heart is an effective pump, but it's not related to decreased sympathetic nervous system activity. Is related to increase. Hey, guess what? The body's going to be notifying the heart, pump faster, pump harder. We have epinephrine, norepinephrine, those catecholamines that are going to stimulate the heart. So we're going to have more sympathetic nervous system activity because the body is trying to push out more. It's going to be tiring itself, pushing out more to get blood throughout the body. So our answers are going to be A and C. And as you can see, here are your rationale for the incorrect answers as well as the correct ones. Love it because rationales bridge gaps, you guys, and that's what we're all about. Hey, thanks so much. This is Tamika Chambers, NCLEX Coach Tutor, here with another question. I will be doing a raffle tomorrow in relation to the NCLEX Success Mindset mini course, giving out a course or two for people that answer a specific question I'll ask. So tune in tomorrow, October the 25th, 2024. Talk to you guys soon.